Hi, everybody. I'm Norm Thurston. I'm the Executive Director of the National Association of Health Data Organizations, or NADO. NADO is a national nonprofit membership and educational association dedicated to improving healthcare data collection and use. We've been involved in hospital data since 1986, and I'm excited today to introduce you to our Hospital Data 101. This is an opportunity for you to learn the basics about state hospital data programs. This session will include 4 modules that will introduce you to those programs, the nature of hospital data, how the data is submitted and processed, and most importantly, how the data is used to create value. Thank you for joining us today.
Welcome to Module 1, the landscape of state hospital data programs in the United States. State-based hospital data programs are essential components of the healthcare infrastructure in the United States. They serve as vital sources of information for policymakers, researchers, healthcare providers, and the public, offering insights into healthcare utilization, costs, quality, and outcomes. This module is intended to provide a high-level overview of these programs, allowing an analyst or program team member to understand their purpose, structure, and value. While the specific structure and scope of these programs varies from state to state, they share the common purpose of collecting and analyzing healthcare data. California's Department of Healthcare Access and Information, for instance, has a long-standing and highly regarded program that collects detailed data from hospitals across the state. Similarly, Florida's Agency for Healthcare Administration maintains a comprehensive database of hospital information used extensively for healthcare planning and regulation. These programs serve a multitude of purposes, all aimed at improving healthcare delivery and outcomes. Primarily, they seek to capture population-level information about healthcare utilization, costs, and quality. By aggregating data from various hospitals, these programs can identify trends, disparities, and areas for improvement in healthcare delivery. For example, data on hospital readmission rates can reveal areas where care coordination needs to be strengthened, while data on surgical complications can highlight opportunities for quality improvement initiatives. Furthermore, state hospital data programs contribute to public health surveillance by tracking infectious diseases, monitoring outbreaks, and identifying public health trends, such as hospitalization rates for chronic diseases and injury. Many state public health programs, including asthma, injury prevention, and environmental public health tracking, rely heavily on state hospital data for understanding trends. These programs also use the data to look at measures of preventable hospitalizations that should be addressed with quality primary care. Because there is value in having a national perspective on healthcare trends, almost all state programs are actively engaged in the Healthcare Cost and Utilization Project, commonly referred to as HCUP. This program is sponsored by the Agency for Healthcare Research and Quality and has been in existence since 1988. It includes the largest collection of longitudinal hospital care data in the United States. Using data submitted by state programs, called partners, HCUP produces several products including state and nationwide databases, software and online tools, and reports, allowing researchers and policymakers to compare healthcare trends across states or at the national level and identify best practices. The organizational structure of state hospital data programs varies, but they are typically operated by a state health agency or a designated data collection entity. In some states, like Indiana, Iowa, and Kansas, the authority and responsibility for collecting the data lies with the statewide hospital association, while in others, like Kentucky, Louisiana, and Maine, it is the role of a state agency to oversee the state's hospital data program. Each program has dedicated staff who manage data collection, processing, analysis, and dissemination. The legal authority for collecting hospital data stems from state statute or rules that mandate data submission by healthcare facilities. These regulations often specify the types of data to be collected, reporting requirements, and penalties for noncompliance. HIPAA, a federal law primarily focused on protecting patient privacy and data access, provides a specific exception that permits the collection of protected health information for public health purposes, including state hospital data programs. This exception allows states to collect and analyze PHI for purposes such as tracking disease outbreaks, monitoring healthcare quality, and conducting public health surveillance. Achieving 100% compliance with data submission requirements can be challenging. Limited resources, variations in hospital data systems, and occasional resistance from healthcare facilities can hinder complete data collection. To address these challenges, state programs employ various strategies to encourage compliance, including outreach and education, providing clear guidance and technical assistance to hospitals on data reporting requirements, data quality audits, conducting audits to ensure the accuracy and completeness of submitted data, enforcement mechanisms, utilizing legal authority to enforce compliance when necessary, which may involve fines or other penalties. The scope of data suppliers for state hospital data programs is largely determined by state regulations and licensure requirements. Acute care hospitals, including their emergency rooms, are primary data suppliers. Freestanding emergency departments, which have become increasingly prevalent in recent years, are also sometimes included in data collection efforts. Additionally, many states require ambulatory surgery facilities to submit data, providing valuable insights into outpatient surgical procedures. However, certain types of hospitals might be exempt from mandatory data submission or may not routinely submit data. VA hospitals, operated by the federal government, often have their own data reporting systems and may not be fully integrated into state programs. This can create challenges for researchers and policymakers seeking a complete picture of healthcare utilization in a given state. Charity hospitals, depending on their legal status and funding mechanisms, might also be excluded from data collection efforts. Similarly, mental health or specialty hospitals may have specialized data reporting requirements that differ from those of general acute care hospitals. State hospital data programs collect a wide range of data elements, providing a comprehensive view of hospital activity. These elements typically include patient demographics, like age, gender, race, ethnicity, and zip code, diagnosis codes capturing the patient's medical conditions, procedure codes describing the medical procedures performed, length of stay, admission and discharge dates, and the number of days the patient was hospitalized. Billing information, such as total charges, revenue codes, and condition and occurrence codes that impact billing. Discharge status, including whether the patient was discharged home, to another facility, or died in the hospital. Information about who provided the care and where, and the payer's name, type, and the patient's relationship to the insured person or subscriber. This rich dataset serves a variety of purposes, such as tracking healthcare utilization trends, monitoring costs, evaluating quality, informing policy, and supporting research. Tracking healthcare utilization trends. Analyzing hospital admission rates, emergency department visits, and surgical procedures to identify patterns and changes in the trends for healthcare demand can help policymakers anticipate future healthcare needs and allocate resources accordingly. Monitoring costs. Examining hospital charges, case mix, and resource utilization to assess the financial burden of healthcare and identify cost drivers can inform efforts to control healthcare costs and improve efficiency. Evaluating quality. Assessing hospital performance on quality measures, such as readmission rates, mortality rates, and patient safety indicators, to identify areas for improvement can inspire hospital-driven process improvements and empower consumers to make informed healthcare choices. Informing policy. Providing data-driven insights to decision-makers can inform effective healthcare policies, regulations, and payment models. For example, data on hospital readmissions can inform policies aimed at reducing avoidable hospitalizations. Supporting research. Enabling researchers to conduct studies on healthcare delivery, outcomes, and disparities contributes to evidence-based practice. State hospital data has been instrumental in research on topics such as patient safety, health equity, and the effectiveness of different treatments. State hospital data programs face several challenges in the ever-evolving healthcare landscape. Data standardization. Standardizing data submission to ensure consistent definitions and formats across different hospitals and data systems remains a challenge. The adoption of standardized data elements and interoperable health information exchanges can facilitate data sharing and analysis. Data security and privacy. Protecting patient confidentiality while facilitating data sharing and analysis requires robust security measures and adherence to privacy regulations. State programs must implement strong data encryption, access controls, and de-identification techniques to safeguard patient data. Evolving healthcare models. The rise of telehealth, accountable care organizations, ACOs, and other innovative models requires adapting data collection and analysis approaches to capture these new trends. State programs may need to develop new data elements and reporting mechanisms to reflect the changing nature of healthcare delivery. Resource constraints. Maintaining and enhancing state hospital data programs requires adequate funding and staffing, which can be challenging in times of budgetary constraints. Advocating for continued investment in these programs is crucial to ensure their long-term sustainability. Looking ahead, state hospital data programs are poised to play an even greater role in healthcare improvement. Advances in data analytics, machine learning, and artificial intelligence offer new opportunities for extracting insights from vast datasets and generating actionable knowledge. By embracing these technologies and collaborating effectively with stakeholders, state hospital data programs can continue to drive progress in healthcare quality, affordability, and accessibility. For example, predictive analytics can be used to identify patients at high risk of readmission, enabling targeted interventions to prevent avoidable hospitalizations. In conclusion, state hospital data programs are indispensable tools for understanding and improving healthcare delivery. By collecting, analyzing, and disseminating valuable data, these programs empower policymakers, researchers, healthcare providers, and the public to make informed decisions that promote better health outcomes for all.